Where exactly does your stomach hurt? Today, let's talk about abdominal pain in men. Let's start with the upper abdomen. Pain in the right upper abdomen is often seen in hepatitis or liver abscess. This is where the liver is located. Hidden just beneath the liver is the gallbladder. Pain here is also common in cholecystitis or gallstones. The pain is usually a dull ache or fullness after eating and may radiate to the right shoulder or back. Pain in the middle upper abdomen is mostly related to the stomach, commonly seen in gastritis, gastric ulcers, or duodenal ulcers. If the pain occurs before eating, it's usually a duodenal ulcer. If it happens after eating, it's more likely a gastric ulcer. Now, if we move the stomach aside, we can see the spleen and pancreas. Pain in the left upper abdomen is often related to the spleen, such as splenomegaly or splenic rupture, or it can be caused by pancreatitis. Pain from pancreatitis is severe, may radiate to the shoulder or back, and is often accompanied by nausea and vomiting. Next, let's look at the middle abdomen. Here's the navel. Pain around the navel is commonly seen in intestinal spasms, enteritis, or the early stage of appendicitis. When we look at the ureters, the white tube-like structures connecting the kidneys to the bladder, stones in the upper ureter can cause colicky pain that radiates from the waist to the middle abdomen. Now let's move to the lower abdomen. Right lower abdominal pain is typical of acute appendicitis. This is where the appendix is located. Right ureteral stones can also cause pain radiating from the waist down to the right lower abdomen or even to the base of the scrotum. Left lower abdominal pain is often due to sigmoid colitis, diverticulitis, or constipation. Left ureteral stones can also cause intermittent colicky pain on that side. Now, let's focus on the lower central abdomen, just above the pubic symphysis. This is the pubic joint area. Pain above this area is mostly related to the bladder or prostate. This is the bladder, and just below it is the prostate. Cystitis bladder infection can cause suprapubic fullness and pain, along with frequent, urgent, or painful urination. Acute or chronic prostatitis can cause dull pain in the lower abdomen, perineum, or base of the scrotum. Now, what is a varicocele? When we remove the skin layer, we can see the testicular veins. Varicocele causes a heavy or dragging sensation in the scrotum, sometimes with dull pain in the lower abdomen or groin area, which worsens after standing for a long time or exercising. This is the testicle, and inside it are the epididymis and spermatic cord. Epididymitis or testicular torsion can cause severe scrotal pain, which may radiate to the lower abdomen. Another common condition is inguinal hernia. This is the inguinal canal, and this ring-shaped area is where a hernia can occur. It causes pain or heaviness in the groin